prepare for the exams, and like how to write the exams, how to present your paper. So first, whatever I have to, what are my opinion, I will tell you. After that, if you have anything to ask, you can ask also. I'm audible, right?
Yes, madam, you're audible.
Okay. So we'll start according to the syllabus point. We will go with how to prepare. So first, today, I've been told to speak about the STREEROGA paper, that is paper 2. So you know that out of the 100 marks in that, 40 marks will be for the long essay questions, wherein you will have 4 long essays, 8 short essays, which will be comprising of 5 marks, giving you 40 marks, and then 20 will be your MCQs. And so now you are in the final year, so you probably will be knowing like how to write, in the sense how many pages and all. But still, for an idea, for the 10 marks question, you can give almost like a 5 to 6 pages, and then for the 5 marks, 3 to 4 pages, and then the rest will be for your MCQs. And time limit also, you will have to finish your 4 essay type questions, that is the long essay, in maximum to 1 hour 10 minutes. Like you if you extend till 1.5 hours, 1 hour 20 minutes also you can take, no problem. And then your short answer questions should be finished within 1.5 hours, and the rest time you will keep for next 10 minutes or 15 minutes, you will keep for your MCQs. Probably you have written all the exams till now, you know all these things, but still. And one other thing what I see is compared to your STREEROGA, that is a paper 2, your paper 1 will be having more number of questions and you will take more time. So that in paper 1, you have to be more careful while writing with respect to the time limit. Now, coming to the topics proper. So your term 1 portions will be asked for 30 marks, and your term 2 will be for 40 marks, and the term 3 will be for 30 marks again. Wherein you know that the second term is having much of the topics of Yoni-Vapath and infertility. So that is what you have to, your questions will be asked more. But before going for that, let us see what is in the first term. So in the first term, it is for 30 marks. So there you have to learn, or you can expect questions for 10 marks in majorly with the neuroendocrinology of with respect to the puberty. So that can be there, and also Artava Vyapath, wherein you can expect for 10 marks. Now, when you are writing Artava Vyapath for 10 marks, you have to write the shlokas, because you know Artava Vyapath shlokas are very small. So Artava Vyapath you have to write with the shlokas, and then you have to give the complete explanations also, because since it is for 10 marks, you have to give more importance for all the Nidana, then the each and every lakshanas of all the Artha Vyapath, and then for the Chikitsa also. Then if it is, it can be asked even for 5 marks also. Then 5 marks, the other expected questions which you can see, one is Rajo Nivritti, then gynecological examination. Gynecological examination, as per your syllabus, it may not be asked for 10 marks. So you have to prepare your gynecological examination for 5 marks, because you know it is a wide subject, or so much things are there in that. So how to write for a 5 marks, you have to prepare. So in that, how you can go is general case taking, and other family history, all those things you explain in small. And typically what is gynecological examination, like per vaginal examination, per speculum examination, you have to give more importance. plus your breast examination also little bit you have to mention with respect to this gynecological examination. So major importance you have to give for vaginal examinations, what findings you are going to, or what is there you are going to check, and per speculum examination. The other things you can write in short because it is for 5 marks. Then the other questions which you can expect for 5 marks are, one is PCOD, then Rejo Nivritti can be asked for 10 marks also. But typically in the term 1 portions, major things which can be asked for 10 marks is, one is amenorrhea, arthavyapathy, and neuroendocrinology with respect to puberty. So these 3 things you have to give more importance and study for 10 marks. Do I have to explain anything regarding each, like how to present or anything, or is this fine? I expect anyone to like give at least one. Okay, fine. Okay. Because how to write, because you know that it's all modern, it will be easy for you. You read whatever, and I think as per your okay. See, because one of you have written like a brief explanation. So neuroendocrinology with respect to puberty, when you are telling, you have to mention mainly about the HPA axis. So HPA axis, what is the total, like how it is acting, hypothalamus producing GnRH, then giving FSH, LH. So that way, how that HP axis is there, or your menstrual cycle, that you have to give importance. And you know that puberty, before puberty, your HP axis will be not working, and then after the changes happens during puberty. So main thing you have to give to the HPO axis. So that is majorly about the neuroendocrinology with respect to the puberty. Rejonivritti, again, it is like you have to give the Ayurvedic reference of Rejonivritti. Then coming to the menopause, what is menopause? For 10 marks question, you are asking whether neuroendocrinology. Yeah, what I mean to tell is, even if it is for 10 marks, the major thing you have to explain, because the whole thing, like regarding the thyroid, everything, if you are explaining, you may not be able to finish your answer in that time. So that is what I'm telling. Like for 10 marks, you write the HPA axis in detail. Okay, if you see your textbooks, you can see that, because like that itself will, you can write for writing the neuroendocrinology. First you have to write regarding the formation of the secondary sexual characters, then action of the hormones on all those uh, reproductive structures, and then you will go for the HPO axis. So that will be enough for your 10 marks. So because there you will be explaining about the pituitary gland, that is hypothalamus, pituitary, and then ovary, right? So it will be almost coming to for the 10 marks. And you have to draw the diagram also, where that how the negative feedback is coming, all those things has to be put forth. Okay. Then in Rajo Nivritti, hope I think it is fine. Yeah. In Rejo Nivritti, again menopause, generally it will not be asked for 10 marks. So you can prepare because the other things are more important. So menopause, when it is asked, give the Ayurvedic reference and then go for the modern of that is menopause definition, and then what changes happening in menopause, and what are the symptoms, or what you see like hot flashes, that is vasomotor symptoms, cardiovascular. So all those things you have to mention, and then mention about the HRT, that is the hormone replacement therapy. And hormone replacement therapy, when you are mentioning, you have to mention regarding the advantage and the disadvantage also. So that is about the Rajanivritti. Artha Vyapat, I have already told. Gynecological examination also prepare only for 5 marks, because as per your syllabus, it may not be asked for 10 marks. PCOD, you know, it is a typical modern. When you are writing PCOD, you have to write regarding the pathology or pathophysiology, and then the symptoms, and then the treatment. So treatment as such, you know that it is like a little bit elaborate. You have to concise it, but at least what exactly in PCOD, you have to have an idea. And according to the present scenario, it is always an expected question also. Then amenorrhea, it can be asked for 10 marks, even though you don't have much of the references in Ayurveda. It is only like Nashtartava. But in modern, it is given in detail, because it has its classification, then reasons, all those things, you know. So you can prepare that like to write for 10 marks, because in few question papers it is asked for 10 marks also. I know your syllabus has changed, but then also you have to expect amenorrhea to be for 10 marks. Then 5 marks question, you can expect even the anomalies of the female reproductive system. So anomalies, you can majorly write about the anomalies of the uterus. Since it is for 5 marks, you just mention like types of anomalies, and better to do a pictorial representation. That is, diagrams is very important in the anomalies of the female reproductive system. Okay. So I think the term 1 portions, almost the main important questions are done. And with respect to the short answer, I mean the MCQs, you can see other things are modern, you can write, but the major MCQs which you will get confused is in the Artha Vyapat. So Artha Vyapat, you have to take each and every Artha Vyapat, you have to make columns and write. See, because when it is asked Kunabha Gandhi, what is the specification of Kunabha Gandhi? Majjoba Samsrishta, when it is, which is that Artha Vyapat. So like that, single word will be there, which is the peculiarity of each Artava Vyapat. So that you have to give more importance as with respect to your MCQs. Okay. Yes. Now let us go to the second term portions. Is it okay? Shall I move to the second term? Anything else? Any doubts are there? You can ask. Now, regarding the second term portions, it is the major portions wherein you have to, it is actually for 40 marks. That is one thing. Second thing is, all the Yoni Vyapat comes in the second term portion. Now, here 10 marks question can be asked, even Yoni Vyapat can be asked for 10 marks. So how it can be asked is according to different acharyas, the number of Yoni Vyapat or the Nidana, like that, or Samanya Nidana, that is how they ask, Samanya Nidana Samprapti Chikitsa of Yoni Vyapat. Then type of Yoni Vyapat according to different acharyas, and any one Yoni Vyapat they may ask to explain in detail. So therein you have to go for all the acharyas name, that is Vataja Pittaja. You know that table is given in the textbook, right? Vataja Pittaja, and which acharya is considering which is Vataja. So that you have to be very clear, because that is always a usually asked question. Then you cannot leave any Yoni Vyapat, you have to learn the shlokas. The major thing for the Yoni Vyapat is, if you write whatever is the matter in that, you are always prone to miss much of the things. So learn the shlokas. Now it's already time if you have not learned, but still try to learn. So if you ask me, I will tell that you have to learn both charakas and sushrutas. Sushrutas, it's only very small quotations, because sushrutas quotation can be asked for MCQs, like dash nashtartam vidyad, or like that, no? So that one word, if you are not familiar, then it will be difficult. Then again in Yoni Vapath, each Yoni Vapath can be asked for 5 marks. So once 5 marks, if it is asked, you have to write the Yoni Vapath. That is, specifically if you know the Nidana of Yoni Vapath, that particular Yoni Vapath, you can write the shloka. Otherwise, you can write the Samanya Nidana of Yoni Vapath, then write, because your presentation also matters a lot in while writing the Yoni Vapath. So if, example, if they are asking you Vataja Yoni Vapath. So Vataja Yoni Vapath, when it is asked, you mention, you give a small introduction, that is introduction about the Yoni Vapath. Then comes your Vataja Yoni Vapath. Then comes the modern correlation. Either it can be like atrophic vaginitis or it can be like endometriosis. And then you will have to write a small comment on that, because this is just correlation, right? Where even if it is endometriosis also, even if it is atrophic vaginitis also, it is just a correlation what they are giving. You cannot exactly tell that endometriosis is this, because atrophic vaginitis, if you see, it happens in the menopausal age, whereas endometriosis, if you see, it is in the reproductive age. And in the Vataja Yoni Vapath shloka, they have not mentioned anything. So just a comment, or just like that is what we expect in your papers, like, just give your own opinion, like some like interpretation or something. Because if you go to the Prasuti paper 1, many places in the book itself, they are giving the correlations or the interpretation. So that also is important in writing. So here also, whenever you are writing a modern correlation, just give few points which can be helpful in atropic, like whatever the modern correlation it is giving. Okay. Now, as I told you, any Yoni Vapath can be asked for 5 marks. And not only Yoni Vapath, even the modern correlations also sometimes it is asked for 5 marks, like endometriosis or pelvic organ prolapse. So the other thing is, like, if the question is asked as pelvic organ prolapse or whatever, if the question is in the modern aspect, you have to give the answer first in the modern thing and then in the Ayurvedic. Say, for example, if Mahayoni is asked, I've seen students writing about the uterine prolapse. No, it's not like that. You have to write Mahayoni shloka and explain in detail about that, and then mention as the correlation as the uterine prolapse. Okay, so that will be the, so if it is a question asked is Ayurvedic term, you have to start with the Ayurvedic itself. Okay. Then yeah, so that is about Yoni Vapath. So once again, I'm giving stress. Yoni Vapath, you have to study all the quotations, because in STREEROGA, what major thing you have to study is like Yoni Vapath only. Then coming to next 10 marks question, what you can expect is, one is infertility or Vandhyatva. So Vandhyatva, you have Sushruta's quotation as Vandhya, Nashtartam Vidya. Otherwise, you have the Harita's explanation of different types of Vandhya. All those things you have to mention, and then mention regarding the male infertility. So if, sorry, infertility in general. If Vandhya is asked, and if it is asked for 10 marks, write more like Ayurvedic aspect in detail. And then infertility, you have to write, but detailed explanation is not needed for the causes at all. Like, you just mention the headings and should go, because otherwise you'll not be able to finish the whole answer. Whereas if they are asking, sometimes the question can come only on one part, like male infertility, female infertility, like that also it can be asked. And moreover, 5 marks question can be asked, like, reasons for female infertility, reasons for male infertility, investigations in female infertility. So wherein I mean to tell that all the parts in infertility you have to learn in detail. Just don't grossly read the infertility and go, because each and every part can be asked as small short questions also. Okay, so like all the investigations, all the reasons you have to study in detail. And when it is for 10 marks, you have to little bit shorten, because if you go to explain each and every investigations and all, so these are the investigations which is done. These are the reasons or etiology of the infertility. So like that you have to mention and go complete it. Then next is Vyadhi Vinishchaya. That is, it generally asked for 5 marks only, because in your syllabus itself it is not given for 10 marks. In between, I forgot to tell regarding the Yandra and Shastra. That is, that comes in the term 1 portion only. Why I just missed it? In theory paper, much of the Yandra Shastras are not, like it was till now, it has not been asked so much for 5 marks or 10 marks. 10 marks, it is not at all there. 5 marks also generally, because that is more with your practical questions, because you will have for spotting and other things, no? So that is where you have to learn regarding the yantras and shastras, but that is also important topic, I mean, with respect to your practical. Just 1 minute. Yes, Vyadhi Vinishchaya, in that, 5 marks question, each and everything they can be asked, like, like majorly it can be regarding the hysteroscopy, pap smear. Pap smear is very important. And colposcopy, cervical biopsy and all, it is, obviously you have to learn and go, that's all. But otherwise, majorly 5 marks you can expect for pap smear and this one, hysteroscopy. Okay. Yes, that is regarding the Vyadhi Vinishchaya. But obviously, in your Viva practicals, any questions can be asked regarding that. But again, it is like it has come under the desire to know topic. So, minimal questions only will be there for the theory. So, that you can keep little as aside. I'm not telling you should avoid it completely, but still. Then, so that is about the term 2 portions. Now, anything is there in term 2 which you have to ask?
I think no question, madam. We can continue.
Okay, sir. Few more things I have to, because I was little running ahead. I thought time will not be there, but still time is there. So I will just tell regarding the Sthanikopakrama. Good that you remembered me. Sthanikopakrama I left out. Sthanikopakrama, you have to study for 10 marks, because that can be asked for 10 marks also, 5 marks also sometimes, but majorly it is for 10 marks. When you are writing about Sthanika Upakrama, if I think in your much of the textbooks it is not only, it is explained in detail in STREEROGA by Dr. V.N.K. Usha madam. That book, it is written very clearly what it is there. So you know that there is no specific shlokas except for Uttarabasti. So Uttarabasti, whatever is there in the Samhitas, that you have to what is the Vaste Puda, Netra size, Puta size, all those things you have to learn what is there in the Samhitas. Then for what Matra is given for Bala, not Bala, for different age, what it is given. So that also you have to learn. I mean, according to the Samhita. After that, practically Uttarabasti, what we are doing, that also you have to give a slight mentioning regarding the Uttarabasti, because you know that even though Samhitas, it is all told like this, what we do is like we use the IUS syringe, and then what are the aseptic precautions we take. All those things you have to explain in how you have how we do it practically. Then all the procedures when you are writing, see if it is for 10 marks, everywhere if you are going to write regarding the pre-operative, because pre-operative procedures and post-operative procedures you have to write for all the upakramas. So if you are going to write for each everything, it will be a waste of time there. So what you can do is the pre-operative procedures, whatever it is there, that you give a common head, common as a common you write first. Then post operative also you write common. After that, single procedures you can write in detail. And as much as possible you try to reduce, try to write as like long sentences. You don't write, just write as point by point, and then you can finish it off. Otherwise, there only, because the decoction is made like that and then it is poured into the, not like that, just wordings you have to write, and then you can finish up the answer there, and you can expect it for 10 marks. So in Sthanika Upakrama, you will write regarding the Prakshalana, Pichu, Uttarabasti, Kshara. In few textbooks only Kshara is told, but then Kshara also is taken as a Sthanika Upakrama. And even Yoni Abhyanga Sweda also can be told as a Sthanika Upakrama. Then regarding the formulations, does the formulation comes in the second or in the third term? It's in the second. Fine. Wherever it is, it's okay. So regarding the formulations, whenever you are mentioning regarding the formulations, few things what you have to keep in mind is, one, you should know the reference. Then few quotations are very big where you cannot, I do agree that you cannot completely learn the quotation, but ingredients you have to learn. If it is like very big wherein it has having like more than 20 ingredients, if you are not able to remember everything, at least major important ingredients you should know. Falashruti should be proper. That for everything you have to learn the Falashruti. So reference, ingredients, and Falashruti. That is how you have to learn when you are learning a formulation. And I know like there are much formulations told in your syllabus, but even that I cannot tell, only this can be asked, but at least a few which are very commonly used, like Pushanaga Churna, Falasarpi, Ashokarishta, Chandraprabhavati, Saubhagya Shundi, Rajapravartini, Pushpadhanva Rasa, Garbhapala Rasa, Shatapushpa Taila. This much at least you have to learn. See, again, I'm telling you, it is not like you should learn only this, but at least this you should have an idea. Okay, because Falasarpi, Pushanuga, it is very repeatedly asked, even Rajapravartini also. But these are the main formulations we use commonly in STREEROGA. Yes. Now we will go to the term 3 portions. Term 3 portions, as you know, it will be asked for 30 marks. That is how it is given. And in that, the Yoni Arsha, Yoni Kanda, that can be asked for 5 marks majorly, because again for 10 marks it was not commonly asked. But when you are writing Yoni Arsha, Yoni Kanda, you have to write the shlokas there, and you have to write the modern correlations also, like Bartholin's cyst or abscess, whatever you have to write there for both Yoni Arsha, Yoni Kanda. Then anatomy of the breast disorders, all those things also can be asked for 5 marks. Here, majorly in the third term, the 10 marks questions can be. Previously, it was majorly the surgical procedures which was asked. Now, the surgical procedures is your desire to know topics only. So, it will not be asked. It is not expected to be asked for 5 marks. 10 marks. It will be for 5 marks only. So, the Arbuda Grandhi, all those things you can expect. That is your benign lesions of the ovaries, benign lesions of the uterus, all those things can be expected for 10 marks. Malignancy, again, it is not much explained, or it comes under the desire to know topics only. So give more importance for all the benign neoplasms, then Grandhi, Arbuda, Ayurvedic portions for 10 marks question. And again, the Sthana Rogas also, that is Sthana Kilaka, all those things are important. It can be asked for 5 marks also. Very sometimes, that is not very frequently, it is asked for 10 marks, because everything you have to explain there with the modern correlations like mastitis and breast abscess also. Then fibroid uterus is one other important question which you can expect for 5 marks. So fibroid uterus, when you are writing, you have to write the types of fibroids, what is the treatment suggested. No need of explaining much about myomectomy. It is a suggested treatment, that's all. Don't explain regarding the myomectomy there. Majorly importance is what is fibroid, what is the reason for fibroid, and what are the types of fibroids, which is more common, and then comes to the treatment of the fibroid. Then treatment also, you know that it is given under different headings, like either watch and see if it is menopausal. So all those things you can write in detail. Then next is Shweta Pradhara, and the vaginal discharges also. So vaginal discharges, you have to mention regarding the leukorrhea. So Shweta Pradhara, you know that there is no direct reference for Shweta Pradhara. So Rakta Pradhara, when you are learning that itself, or the Pandura Rakta Pradhara is considered, or it can be taken as Shweta Pradhara. Ashridhara also is one of the important topic. It can be asked for 10 marks also, wherein you can write there is Ashridhara, when you have lot of things to write in that, because you can write regarding the definition, then Samanya Nidana Samprapti, types of Ashridhara. Types of Ashridhara, you need not learn the shlokas, you can write whatever is there in Vataja, Pittaja, Kaphaja. Then comes to the treatment aspect. That also Samanya Chikitsa, and then different types of Ashridhara Chikitsa also, you have to be very clear. Then self-breast examination is also important. It can be asked for 5 marks. Compared to the other topics which I told, self-breast examination is not that important, because you have to give more importance for the other things, like the fibroid, uterus polyps, and other things. STD is also one question which can be asked. Any one disease they can ask. So that also you. So and when you come to STD, you just mention what is the specific disease, what is the causative organism, then what is the treatment protocol. That way you prepare different state like few points and then write accordingly. And I know that modern portions will be easy for you to read rather than the Ayurvedic, wherein you struggle to read the quotations and all. Then last will be your surgical procedures. Surgical procedures, according to your new syllabus, it is asked for 5 marks only. When you are writing the surgical procedures, any surgical procedures, you have to write pre-operative procedures, then operative procedure, post-operative procedures. All these 3 points should be there in your answer. So generally what happens is like just you mention about the procedure and go. No, it should not be like that. Why this is included in your syllabus is to know how to go for a surgical process. So you have to learn what is like you have to write as different headings itself: pre-operative, operative procedure, post-operative procedure. All those things should be written in your answer sheet. Now coming to the hysterectomy, whether it is vaginal hysterectomy or abdominal hysterectomy, the main thing what you have to understand is, as I told you, pre-operative, operative, you have to write. In the operative procedure, major importance is given to the points where you are clamping. Okay, so first clamp, where to put, second clamp, third clamp, and how to cut. So that 3 clamping or 4 clamping, if you are learning or if you are writing, that will be a perfect answer. You don't have to write all in your textbook it is given so much detail, no? So that if you don't write also, it is fine. Just give the muscles and ligaments where the clamping is done. So that 4 points if you write, and pre-operative, post-operative, if you write, your hysterectomy will be completed. So because I know that rather than all the other procedures, hysterectomy only you will be finding it much difficult how to write the answer. So only I told this point. Because DNC and other things, it is more easy for writing the procedure as such. Only hysterectomy you will find little difficulty. So it is that way you can write. Did I miss any points? I think I have done almost all points. No, again, regarding the last programs, that you have to, each and everything you have to learn for 5 marks. Obviously one thing will be asked. One question will be there from your health programs. Okay, so that you have to learn, you have to write at least like 2.5 pages for each programs and learn that. Then Aushadhis, I have given you an idea how you can read. Shastra Karma. Shastra Karma, even though everything is given as desire to know, so majorly first you learn regarding the hysterectomy, then DNC, then tubectomy. This will be your, this is what you have to learn as per your theory part. Myomectomy and all, I don't think. New syllabus, even I'm not very sure, but still, you study DNC first, then hysterectomy and tubectomy. I think tubectomy already you would have learned in your second profession also. Then next is like medical ethics and whatever documentation and other things. So there you can expect that questions you can expect, but still That will be like only for small marks, because that is all. Even though it is a must know topic, it is only for like short answer question it is given, no multiple choice, no uh, long essay questions. So just read and go, that's all. Just you should have an understanding what is told in that, you can write on your own, because all those things are like just whatever you see, or just common things is told in that. Yeah, I think I have almost covered all the portions. How to like what important, which portion you have to give it more importance, and wherever you have to give stress. It's almost done, I think. If you have anything to ask, you can message and ask me. I can tell in that way.
Thank you, madam.
Thank you, sir.
Students, if you have any doubts, please, you can ask. Either you can put in chat box or you can unmute yourself, you can speak. One question, ma'am. Topic 25. Shastra Karma in STREEROGA has all
Yeah.
DQ
Yes,
in
yes.
get out.
Shastra Karma in STREEROGA, that even I have seen Shastra Karma in STREEROGA, all are desired to nice to know topics. But in distribution of marks, it is given as 10 mark, 5 mark, and MCQs. That is true. So that is what, since it is the first batch which is going to write the exam, even I cannot completely tell how it will be going. Because previously, if you till your seniors who have written exams, vaginal hysterectomy, abdominal hysterectomy was asked for 10 marks. But since it is coming into the desire to know topic now, it should not be asked for 10 marks. That is what according to the new syllabus. So think that you prepare as for 5 marks only. That is what, so if at all it is asked for 10 marks, then you can write indication, contraindication, and other things, and make a little bit elaborate your answer. Okay, as per 5 marks, you study now. That will be better. Because in that, even sir, I also, I'm not very sure, sir, because as the doubt is true only what they're asking, because it is desired to, so desired to know topics, as they are telling, it should not be asked for 10 marks. But in the, again, in the other things, they have given for 10 marks. So as I have seen previously, this hysterectomy was asked for 10 marks. Rest things it will not be asked. So study for 5 marks. If at all it is asked, let them elaborate with the indication, contraindication, and like that.
Another question, madam, regarding Stree Yoni and labor.
Stree Shroni and labor. I mean, what you want to know? Like how to, Stree Shroni, it can be asked for 10 marks also. So Stree Shroni, what it is like, you should go with all the maternal pelvis. It is not just the what Shroni you have learned in the anatomy. That is according to this is the measurement of the Sri Shroni. Not that. You have all the diameters and all given, no? Like maternal pelvis is divided into mid pelvis, lower pelvis, and the all those things, like you have the diameters like obstetric conjugate and other things, it is given, no? When measurement also. So that is what you have to write when it is asked for Sri Shroni. It can be asked for 10 marks. And labor again, it is like 10 marks. It can be asked like any question from labor, like what is labor, stages of labor, or mechanism of labor alone for 5 marks. Mechanism is very important. Sometimes like, small like crowning, etc. That can be asked even for MCQs also. So labor, you have to be, you can expect 10 marks or 5 marks from, because only management of second stage of labor, like that they will ask for 5 marks. There you should know, or in other way also ask, like management of Upasthita Prasava. So you should know what is Upasthita Prasava, because we don't have any Ayurvedic management told in our textbooks for first stage, second stage. So when it is asked for Upasthita Prasava, you should be able to know that it is second stage of labor or which stage of labor, and then accordingly you will have to write the Ayurvedic and the modern. So that is what stages of labor, Ayurvedic part is also important to get a correlation with the modern thing. Okay.
Thank you, madam.
Labor, it is clear.
I think it's
Rajat
clear,
has
madam.
asked question. Okay.
Any other questions, students? Do you have any questions? If you have difficult to type, you can also use unmute yourself. You can ask. If nothing means, we can conclude the session. Okay, shall we conclude? If you have any doubt, you can ask. I think no doubt, madam.
Okay, sir.
Thank you so much, madam, for giving your time for our students.
Thank you, sir. Thank you,
so
sir,
much,
for
madam,
asking me to take a class also. Thank you, sir. And
giving
all the students, best of luck.
Thank you so much, madam. Thank you, students, and from our Ayurreshmi team, and also to students, thanking you, madam. And we need your further support also. Thank you so much, madam. Namaste. Namaste. Tomorrow we are having last class of our orientation by Dr. Ayana sir, by for Shalya, part 2. We will meet at 6:30. Thank you so much. And their recording will be sent by tomorrow evening. Thank you. Good night. Thank you, madam.
Thanks.